In South Carolina and across the nation for that matter, fentanyl has become the primary driver for overdose and the leading cause of overdose deaths. In 2022, nearly 3,000 drug overdose deaths occurred here in South Carolina. Now the city of Columbia is getting some help to help reduce those numbers. Joining me now is Dr. Fordham and Patsy Gardner with the Second Chance Resource Center. Thank you all for being here. Really appreciate it.
Thank you for having us.
Yes, thank you for having us.
So this is a serious topic here. We talk about, even here on Watch Fox, a number of news stories about opioid deaths. We've seen the increase of many cities now having to deal with this. So the City of Columbia's Office of Neighborhood Safety and Engagement, you all were awarded the Opioid Recovery Fund. How did this happen?
That's correct. So it's part of the opioid settlement provided to the state, and the City of Columbia had a stake in that. So we were able to put in a proposal and write it up for our opioid recovery funds to actually work with and to reduce the numbers across the City of Columbia by working with community partners like Ms. Patsy and the Second Chance.
And we'll get to Ms. Patsy in just a moment. So what comes along with the funding, Dr. Fordham?
Right, so with the funding, we actually did an entire proposal. So it comes with a prevention and education program. It comes with purchasing and handing out Narcan doses and working with community organizations. It comes with some prevention programming. It comes with research, data collection, and furthering the work not just here in the City of Columbia, but across the state. And there's also going to be some trainings as well, too. So again, it's a very comprehensive package that we put together. Okay. And again, we were able to work with community partners in order for us to do that.
And speaking of community partners, we have Ms. Patsy Gardner with the Second Resource Center. So tell us how you all are going to work to help with this endeavor.
Okay, thank you. Yeah. We have a holistic approach. We serve the whole person, the whole family. So while we're out in the community, we will be providing a wraparound service. The wraparound services can consist of job employment, training, housing.
Mm-hmm. And these are for individuals who are coming off of drug use or so, trying to help them as well, or just in general?
So it's going to actually be in general. Okay. So as our first responders come across some individuals that may be using substances and need those treatment recovery services. Gotcha. But again, as Ms. Patsy can share more on, her team will actually be out and about as well too from an outreach standpoint. Yep. And so will we throughout the City of Columbia when we come across individuals. So it won't just be folks just with you know, substance use.
Gotcha. So Ms. Patsy, what is that like? How are you all helping these individuals, second chances, for instance? How are you all doing that?
Yes, actually, we're actually boots on the grounds. We're out in the community. We're not sitting behind a desk. We're going in. We're actually doing assessments. We're doing intakes, and we're meeting them where they are.
Dr. Foreman, speak to the grant funding again. Can you talk about how much it is, or is it an expansive time? Is it a one-term type of deal, or what?
Right. So the City of Columbia is part of what they call the Guaranteed Political Subdivision. So we have a pot of funding, a total pot that we were able to use, and we applied for and we received through our office. It was a little over $509,000. Yeah. So again, as Ms. Patsy said, that's why it was important for us as a city to really work with community organizations who were boots on the ground, who could be out there every single day providing these resources and these services, not just for individuals, but also with their families. Yeah. When we talk about just substance use in general and opioid use, there are a lot of drivers that are behind it. So thankfully, again, from Second Chance and the work that they do, they're able to provide those other supportive services, those wraparound services to help folks not only with their substance abuse and treatment referrals, but also as far as housing, mental health, and other supportive services. So that's why it was important for us as a city.
And your office is fairly new for the City of Columbia. Correct. And we have to say hats off to you in your office, because you deal with a lot of trouble, we'll put it that way. Right. You deal with a lot of trouble. So how is that going to help further the city's mission to make sure that everybody is well taken care of?
Right. So our office was established as the Office of Violent Crime Prevention initially, right? But as we got out and we started talking to community members and residents, we really realized that we can't really have a full conversation about violence reduction or prevention until we started really talking about neighborhood safety and personal safety. And we looked at some of the root causes of violence. And of course, substance use is always right there when we talk about violent crimes being involved. So that's why it was important for us to really look at how we can utilize the SCORF dollars to work with community partners. And we're seeing impacts already when we talk about boots on the ground, the referral services, when we talk about individuals and them getting the help that they need. So it's definitely looping into not just as far as violent crime prevention, but also when we talk about the community engagement, the safety, you know, it's definitely helping.
Ms. Gardner, for some people that might be watching, what you all do is pretty tough. Boots on the ground, dealing with individuals who are who need to recover. What is that like?
Well, believe it or not, I'm 35 years out in the community. So what we do is we think about empathy. We put ourselves in the shoes of those individuals and we meet them where they are, because you have to be authentic. If you're not authentic and you can go out there, they're not going to receive the services. And so when we actually go out there, we actually let them know that we're here, we listen, we're here to help you, and we provide them with those needs. If it's a light bill, then guess what? We have community partners. We get that referral out there. Wow. Because we make sure we're not using a Band-Aid approach.
Wow, there it is, for second chance so they could thrive and be well.
Yes.
Wow. Dr. Fordham, anything else you want to add about this opioid fund that you all received?
Yeah, so I just want to say that again, Second Chance, they're an impactful partner for all the work that they do statewide. We're also working with the Courage Center on this project. So the Courage Center, their primary piece will be peer support recovery coaches, where they'll go out with first responders after there's been an incident, but also as far as doing individual and group sessions at their facility as well too. And all of these services provided by the case management by Second Chance and also the Courage Center are free, and that's how the SCORF award or Opioid Recovery Fund award is having its impact. So we definitely want to get this information out to folks so that way they can get the services for those who really want to get those services.
Well, Dr. Fordham and Miss Patsy Gardner, thank you so much for being here. We really do appreciate it. Stay up to date with this story and more. Subscribe to our Watch Fox YouTube page. Be sure to like, comment, subscribe, and click the notification bell to never miss an update.